Hi and welcome. This is Dr. Devashish Sharma again. I'm a practicing spine surgeon at Jaypee Hospital, Noida. For those of you who have already watched the last video in which we have talked about low back pain in pregnancy, this is a follow-up video. A lot of our viewers wanted us to talk about practical tips which they can use in their lives during the pregnant times and also during the normal times in which they are feeling back pain. So what to do to avoid low back pain during pregnancy? So tip number one, first thing you have to know is you have to wear low heeled shoes. So your shoes should have a low heel, but they should not be flat. They should give you a support of your arch. So the foot already has few arches and those arches have to be supported by your footwear. And at the same time, it should have a lower heel. Tip number two. This is a very important tip in which we will talk about lifting of heavy objects. So when you're pregnant, your body is already susceptible to various injuries due to the laxity of ligaments, as we have talked about in the last video. You should always get a help of lifting any heavy object. You should never lift a heavy object by your own, especially by bending. It's always good to call for help. Tip number three. How to sleep. So it's important to select a mattress which is firm in nature. Here I really want to emphasize on the word firm. That simply suggests that the bed has to be not very hard and not very soft. It has to be firm so that if the bed is too soft, it will lead to back pain, and if the bed is too hard, you may not feel comfortable during sleeping. Tip number four, bending. So whenever you have to bend, you should always squat down, bend your knees and keep your back straight at all the times during bending, because if you bend the back, there is a high chance of having an injury. Back should be kept straight and you can squat down by keeping the whole back straight. Tip number five, the chair which you use during the working hours should be of very good quality and have an adequate back support. If you don't have a back support in your chair, you can add an extra support called lumbar support. People who drive frequently or spend long hours during driving are advised to have a lumbar back support in their chair added if they don't have it already in their car. Tip number six, whenever you sleep, it's advisable for a pregnant woman to sleep on the sides with pillow supporting between both the knees. If this position is very comfortable for a pregnant woman. Tip number seven, if you have back pain, you can always apply heat packs and cold packs. They are generally very helpful. During the acute case of the injury, if you've got back pain which is very recent, you can apply cold packs, which is helpful. And if the back pain is more than 3 to 4 days old, hot packs are generally advised. Tip number 8, rest. Rest is a very important thing. And if you rest in a so-called 90-90 position, that is, your hips are flexed to 90 degrees and your knees are also flexed to 90 degrees, this relieves the lumbar lordosis or exaggerated curve of your spine and leads to relaxation of the back, which can reverse the lordosis and also reduce the pain in your back. Tip number 9, you should exercise frequently. The trunk strengthening exercises and back flexion exercises for abdominal strengthening are recommended, but should always be done under the guidance of a qualified physical therapist or a physiotherapist who has prior experience in dealing with physiotherapy of the pregnant. Okay, so tip number 10, if all the described measures from 1 to 9 fail, it is always good to get a spine consult. It is always good to meet a doctor, a spine surgeon or a spine specialist who would evaluate you in detail and may require to investigate you, but will give you a proper treatment so that you can heal faster without letting your body to go into further complications. Hope this video addressed all the queries you had. If you have any other queries left, you can contact to us with the undersigned links. Thank you and have a great day.